Hi, it's Dr. Doug McKenzie in Santa Barbara, and it's April 3rd, 2020, in the age of COVID-19. And I wanted to expand on what I had talked about in a brief video recently with regard to small injuries, minor injuries, and visiting the emergency room to get those treated. And talk more in detail about wound care and some of the products that you might use and some of the opportunities that we as plastic surgeons can offer on an outpatient basis that might be a much better alternative than going to the emergency room or even going to urgent care for treatment. So, yeah, you know, going to the emergency room, even before COVID-19, we've all been there, right, for various things. And first of all, you're often waiting for hours. The bill that you get afterwards, or bills, could be enormous. And you're possibly around a lot of sick people, and that's certainly the case now with COVID-19. So if you can stay out of the emergency room, that is a good thing. And for most people, no matter what kind of insurance or you have or don't have, you know, your out-of-pocket expenses are probably going to be less by going to a plastic surgeon's office versus an emergency room. And, you know, call around. I mean, you know, negotiate if you need to. But, you know, most plastic surgeons are happy to do this kind of work even before the COVID-19 thing. I always used to tell people, you know, if it's during the day, certainly just call my office or call someone else's office and see if they can get you in and we'll fix you up. And again, I'm talking about minor wounds, that kind of thing, lacerations, okay? So things that would not qualify would be like multi-trauma, right? If you've been in a motor vehicle accident, you might have other injuries, obviously. You're gonna go to the emergency room, they need to rule you out, they need to check x-rays and, you know, make sure if it's a facial injury, that your neck is okay, et cetera, et cetera. So, you know, again, I'm talking about common injuries from you know, falling off a bicycle, if it's something minor, cutting your finger in the kitchen with a kitchen knife, you know, that kind of stuff. Anything where we don't have to rule out other injuries or if there's any other symptomatology that might indicate some other kind of problem. The other thing that might not be good for the office situation are younger children. So if a child is less than 12 years of age, they typically will not sit still to have a delicate repair done on a facial laceration, for example, okay? So that means they have to go to the emergency room and get some sedation. There might be offices and surgery centers that do have capability for sedation for younger children, but you'd have to check that out. So that's something that usually will unfortunately necessitate going to the emergency room. Just because an injury happens at night, don't think you just have to run to the emergency room. If it's a clean wound, or if it's a mildly dirty wound that you can clean properly, and we'll talk about that in a minute, you know, clean it, dress it in the morning, call around, and come in and we'll repair it then. I think there's a misconception that all wounds need to be sutured right away. That's just not true. Weekends, again, call around, you know, especially now, COVID-19, we're all sitting around, so we're happy to help. So let's talk about wound management, wound care. For a clean wound, let's say a clean wound, an example would be, you know, you're cutting some onions and you slice your finger. That's a clean wound, assuming you didn't pull the kitchen knife out of the, you know, out of the garage or something. Just wash it, soap and water, put a dressing on it, a little pressure if it's bleeding, elevate the hand. If it's the face, again, soap and water, a little pressure till it stops bleeding, and a dressing. A little peroxide's fine, a little betadine if you have that. I could show you, you know, peroxide, everyone has this in their home, right? 3% hydrogen peroxide. Betadine or povidone iodine swab like this would be good. Although, truthfully, not that necessary, but it's okay. Now, in wounds that are perhaps dirtier or are a blunt injury, they're a little more complicated. So, if someone falls off their bike and gets a road rash and they've got gravel in the wound, okay, that's number one, somewhat of a dirty wound. We want to clean that out. Soap and water might be enough. But if there's visible particulates in the wound, you want to get those out. And that sometimes requires a little brushing or scrubbing to get those out, because if they're in there for more than about 6 hours, the fibrin that your body lays down in that wound is like glue, and it will literally kind of glue that in, and then it's really difficult to get it out. And if it's not taken out, it can be like a tattoo. Literally, you'll see the hue, the color of those little foreign body specks. So that's one thing where if it happens at night and you can't really clean it properly, well, then you probably need to go to the emergency room, get it cleaned properly. And in the office or in the ER, we'll put topical numbing on it or inject it with local anesthetic and clean it out really well. If a wound is irregular, typically with a blunt wound where the tissue, sort of the skin bursts, unlike a knife edge where it's nice and clean and sharp, that edge is going to be kind of just beat up, and the edge is literally crushed by the injury that busted it apart, right? You can imagine. So that tissue is needs to be debrided. If it's relatively clean, again, it could wait a little while, but it's going to need to be debrided. And what that means is that any devitalized tissue, including the skin edges or anything underneath that's crushed, is going to need to be cut away, literally with a scalpel or fine scissors. All right, so that's something that we can certainly do in the office in most cases. Debridement is one of those things that is very important, and a lot of people don't really realize it. And people will often want a plastic surgeon in the emergency room, often for some minor injury, because they want the scar to be as minimal as possible. And it's understandable, but most clean, sharp wounds, frankly, can be closed very well by an emergency room physician. Some of them are excellent, and you'll get just as nice of a scar. But where it matters is where an injury is a crush injury or a very irregular, jagged injury. It can often take just as much time to prepare that wound, to debride it sharply. And that's where a plastic surgeon's going to take that time to do that, and perhaps the emergency room physician might not. I mean, you can imagine if an ER physician, maybe the ER is not even that busy, but they're the only physician there at night, for example, well, they're going to be ready for a heart attack that comes in or something like that. Or if it's a busy emergency room, same thing. They've got several people that they're treating and managing and waiting for labs and waiting for x-rays, and at any minute, a major trauma could come in. How much time are they going to spend at the bedside debriding a complicated wound? They're not going to do that. So now, in some communities, obviously, there are plastic surgeons on call ready to go, such as here. But in many communities, there's not. So you might get the wound cleaned and repaired, but not very precisely. So then it's a matter of either following up with a plastic surgeon or letting it heal and waiting to see what happens, and then down the road maybe having a revision. There's some other injuries that deserve note. Even if the wound is clean but the tissue is devitalized, which means that it doesn't have a blood supply, and this could happen, for example, with a finger injury or even a facial injury, particularly if it involved the ear or the nose or the eyelids. Those kind of injuries, again, they're a little more urgent, maybe not emergent, but urgent. So you don't want to necessarily delay them until the next day. Cartilage in the ear, for example, you don't want that to get infected. Any devitalized tissue is more prone to bacterial colonization and infection. So again, those need to be debrided sooner rather than later. Does every injury need stitches? Well, an injury that goes through the deep layer of the skin called the dermis definitely needs stitches, unless it's a very short injury and it could be maybe just pulled together with a butterfly bandage or a steri strip. But even if an injury doesn't go all the way through the dermis, if it goes into it fairly deeply, you can still have a scar. And again, if those edges aren't really pristine, they need to be debrided, and then stitch is probably a good idea. I mean, occasionally we can do a steri strips or a butterfly type bandage on a small wound, but if you've got a significant length and it's into the dermis, and certainly through the dermis, yeah, you're going to need stitches. And then certain areas just need stitches, like over joints, knees, elbows, shoulders. Those do not do well with steri strips or Dermabond, which is the tissue glue, right, skin glue. That's okay for some things, but not over extremities typically on the surfaces that flex. So stitches are done often in layers too. If there's deeper layers, we're not just stitching the skin closed, and that's one of the things that we do as plastic surgeons. So while we're debriding a wound, we'll be looking at the wound and seeing how deep it is and what other structures are injured. Could it be muscle or even tendons in the hands, for example, even nerves, and those can be repaired. Some of these injuries would be repaired in stages perhaps, so a deeper tendon injury like a flexor tendon or nerve injuries to a finger, for example, or forearm, those can be done at a later date. Not too far in the future, especially with a tendon injury, but it doesn't necessarily have to be closed and repaired immediately. In the face, if there are facial fractures, the fractures can be set at a later date and the soft tissue, the skin, closed immediately. But again, that's going to be a situation where the patient's most likely going to be in the emergency room, because if they've got facial fractures, it was probably a pretty significant injury, and they're being ruled out for neck trauma and that kind of thing. Let's talk about products to clean wounds with and dress wounds with, and even treat minor wound infections, that sort of thing. A lot of people obsess about what kind of antiseptic or what kind of antibacterial soap needs to be used for a wound. Frankly, the most important thing is soap and water. Soap and water. So whatever kind of soap you have and water, just clean it out. If you want to use a little hydrogen peroxide after that, that's okay. I wouldn't use a lot of hydrogen peroxide, and certainly not for many days, because it is tissue toxic. It does poison the fibroblasts to some degree, so it can impede wound healing if you use it too much, and it's just usually not necessary. If a wound's if there's a dirty wound or a crusty wound or a wound that's maybe looking like it's a little purulent, like starting to get an infection or colonized, yeah, I might use hydrogen peroxide. Antibacterial soaps, they're just not necessary. And we have some in our office. I got this from our office, and it's got triclosan. We use it, the employees. I hate this stuff. We shouldn't have it. I should get rid of it. Triclosan was taken off the consumer market recently. It's an antibacterial, but it's completely not necessary, and it's got some toxic properties. So yeah, don't obsess too much about what kind of soap. Rubbing alcohol, that's okay too. That'll kill germs. Stings more than peroxide. Betadine or povidone iodine, those are all, those are good things as well to use on fresh wounds. Chlorhexidine gluconate or Hibiclens is a good wound cleanser if you have it. Not a lot of people have that at home, but that's effective. As far as putting antibiotic ointments and such on wounds, most wounds, if they're clean, a little bit of ointment like Neosporin ointment or triple antibiotic ointment or bacitracin, Bactroban is a good one. They're all fine. They're all fine. And there might be some evidence that using a triple antibiotic ointment helps with regard to post-operative or post-injury infection versus nothing. But frankly, again, the most important thing is the proper debridement and cleaning and closing of the wound. So you shouldn't hang your hat on what kind of antibiotic ointments. They're not that great, really, and they're certainly not going to treat an infection. I think if someone's getting a little wound infection, the best things are, well, topical Silvadene, for example. Silvadene is silver sulfadiazine, so it's got sulfa in it, and if you're allergic to that sulfa products, you may not be able to use it, but it's a great antiseptic cream. They use it in burns all the time, and there's no bacterial resistance. Neosporin, if you use that too long, you can get bacterial resistance to it, so I'm not a big fan of Neosporin and triple antibiotic ointment. Silvadene's great. Silver in various forms, ionic, colloidal, and compounded, like the silver sulfadiazine, has been used for a long time in wound care, and it's just fantastic. This is Silvadene cream, very commonly used, works great, dirt cheap. Silver nitrate is another compound that's often used in burns, but we use it as a stick, as a cautery stick. This is silver nitrate cautery stick, but it's also antibacterial. So those are great products. I like silver sulfadiazine, Silvadene, when a wound is starting to look like it might be infected. And then, of course, if a wound's really getting infected, the stitches might need to come out, might need to be debrided. Things that might lead a wound to be infected are if there was devitalized tissue left behind or a foreign body left behind, which could be like, you name it, anything, wood chip, a broken tooth in the mouth, for example, dirt, gravel, those are all foreign bodies. Are antibiotics necessary after wound repairs? The short answer is no, but there would be situations where I think it might be indicated. Some surgeons might do it, like let's say a bite injury in a diabetic. So obviously you've got a high risk kind of a wound. Bite injuries tend to be dirty. They're often penetrating injuries, especially if it's a cat or a dog bite, and human bites are dirty bites. And someone who's maybe more susceptible to an infection, like a diabetic patient, that might be an indication for antibiotics. But again, it's still mostly all about wound preparation, cleansing, and proper repair. And deep wounds, penetrating wounds, puncture wounds still need to be properly cleansed deeply and debrided and repaired. So the vast majority of people, though, no, not antibiotics. They have their own set of problems, as we all know. Okay, so I hope this was helpful for you. And again, any kind of minor injuries, think about going to an office, a plastic surgeon's office, where there's going to be a lot less traffic, a lot less people, a lot less exposure, especially now with COVID-19. Probably going to save money, and you'll have a really nice result from your minor injuries. So thanks, and take care.